All right, ladies and gentlemen, welcome back. And I'm so glad to already have my honored guests here right now. Today I'm interviewing Derry Heron and Catherine Brown from Benguela Health. Catherine and Derry have a passion for strengthening and perfecting health systems, and we're honored that they accepted our invitation here to join us at the Future Health Virtual Summit. Catherine, Derry, hi, how are you?
All good.
Very well.
Nice to be here. Thank you.
It's
Thanks,
a
it's great to be
pleasure
here.
to have you on. Do you have any opening remarks before we start with the questions?
Yeah, just that I think that's going to be an incredibly tough act to follow.
Yeah.
It was a fascinating discussion with Tom, and I mean those insights are fantastic. Some very real questions, and lots to learn. So this is going to be a tough one.
I'm sure it's going to be exciting, and perhaps we can tackle some different questions and surrounding topics. So I'll just start off. So the title of the session is the healthcare transformation and what is essential to adopt innovation. Shall we start with maybe a general question like that?
Yep, perfect.
Go for it.
Catherine, would you like to start us off?
Sure. So Derry and myself work not in the clinical sector of healthcare, so we're healthcare consultants. We work both across the sort of public and private healthcare sectors, and we deal with a lot of change, not necessarily from a clinical perspective, but more from the health systems and the governance side of things. And I'm sure this isn't news to anybody, but obviously the most difficult part of change is the people involved in change, and how you motivate people to change their behaviors and to change the way they do things is the most difficult part of doing things. And in order to have people adopt innovation, that's the most important part. Derry?
Yeah, I mean, we get asked a lot
Yeah.
of the times, you know, with a lot of projects and in different scenarios, saying, you know, people getting frustrated with there's this great new way of doing things, and it looks like it's been proven, etc. And where people seem to ignore it, and they're not taking it up, and you know, what's the problem? So I mean, I guess the first thing is to ask the question, you know, around the adoption of innovation. I actually don't think there is a problem with adoption of innovation. You know, if something is truly innovative, innovation is almost a retrospective comment in itself. We only think of things that are innovative after they have changed our lives. You know, there's plenty of failures in there that we don't say is innovative, but they meant to be innovative. And I guess the difference is, or the trick is understanding what was the difference between the ones that worked and didn't work. And you know, we often pose the question, you know, what do we need to change? And that's where you need to understand it's not so much the purely doing things differently for different sake. You know, that's easy to do. It's really about understanding why people change the way they interact with things. Why do they change the way they behave to get better outcomes? It sounds very philosophical and high, but it isn't. When you start boiling down to, you know, what drives the behaviors of groups or individuals to behave within a certain way, and more importantly, what doesn't get them to change. And that's where the trick lies, because there are a lot of misconceptions. Right? So healthcare is full of great technology and great ideas failed. And failed not because the idea or technology was bad. It was because the assumptions around people would interact with those things were flawed. They were misunderstood. And we see it all over the healthcare spectrum. We see it from the clinical side. We see it from the technology side. We see it pre-healthcare. So in all the things that we within our environments and within the player that we see of people accessing services of well-being. So things around that happen before you enter a healthcare system. How do we stay out of the healthcare system? There's a lot of work around health and well-being and in there. And 90% of it, unfortunately, is flawed. People just don't behave the way they behave. So if you wanted the answer to the question, what's the big ingredients in there? it's not so much understanding what is the great idea or what's the next best thing. It's about understanding who will use it, what is the utility they will get from it, and what's the reason that they will interact with this thing. If you get that and you understand it, then you start to affect change and thereby innovation. And if we again start using the retrospective view of it.
Yep. A good example of that was I've been working on a series of dashboards for laboratory service, and we've been working on them in different views and different perspectives for a few months before COVID. And then COVID-19 obviously arose, and all of a sudden it became crystal clear exactly what they needed to see, when and by and at which level of detail, and it crystallized everything. And we went from sort of 30-40% engagement with the dashboards to almost 90% engagements, because it became clear very quickly exactly what was needed to be seen, exactly what level of detail was needed, and who needed to see that detail. And understanding those as quickly as we could meant the development went that much more quickly, and the level of engagement went up that much more quickly. And it was exactly as Derry said, we had our audience right, we had what they needed, and we had the why behind it, and that made the engagement climb extraordinarily quickly.
Thank you
Derry.
very much, Catherine, for that. So where do you see most of the challenges in doing this?
I mean, how long is a piece of string? I mean, it's really the size of the problem you're trying to tackle. I mean, it could be, something as simple as a patient adherence regime to something as complex as what would it be? Provider behavior. So looking at situations where you require your doctors, specialists, and those that operate within the health system to begin to interact with that system in a different way. So then you're looking at a wholesale systemic change, and those require kind of efficient solutions. Some are easy, some are hard. Right. So the challenges there are anything. The trick is to understand what the motivators are in terms of getting people to engage. And we will talk about it, I guess, a lot more about change and engagement and habits than we would about innovation, because you can't get one without the other. Right? So, that's kind of where we start off. So the trick is to understand in a health system that innovation in one area does not, or innovation and usefulness in one area doesn't necessarily mean the same thing in another area. So we generally work in a health system, and I work a lot in a private health system. So you have a triangle or a three-way kind of relationship there between the healthcare provider, whether it's a hospital or a doctor. We have the patient, obviously, but then you have the funder of that care. It'll be an insurer or something along those lines. And it's really hard to understand that if I'm going to apply some level of innovation or some level of change that makes things better, who does it make it better for? And if it only makes it better for one of those parties within that arrangement, is that actual change? Is it deep enough, and is it impactful enough to adopt it? So to get the answer to that, or to make sure that it is, you need to understand the motivations between all of those. And these are not hard things. We all know this. I mean, this is really basic kind of healthcare, but it's often overlooked, very often overlooked, because particularly technological information or clinical innovation or ideas or change or new developments are so research and technology and time intensive that we can often lose sight of the big picture. So a technology provider may come in and say, we have developed a new electronic health record for a hospital that collects data from everywhere, from the cloud. It's real time. It gets fed into devices. And we've seen that a lot. In fact, if you want one of our flags in terms of largest underwhelming areas where we've seen a lot of effort put in and very little kind of change or or return in advance, it's the area of electronic health records and the whole ecosystem that surrounds it. Because we often forget about who's benefiting from this and why are they benefiting from this? And is the reason for that sufficient enough to drive wholesale change in a health system? And often that answer is just no, it isn't. Because sometimes it's just to help a hospital bill better, or an insurer to make sure that they get billed less. You know, almost all the time it's a pain for a patient because they have to do something different, and it's it's another hoop I have to jump through. So these things, because they're overlooked and they're not looked at as a holistic system, often fail. It's a huge challenge, and it's because what may work here in South Africa, for example, may not be applicable or work somewhere else. You know, we have a very specific set of rules and a very specific health system. So the portability of healthcare is actually difficult. And the portability of technology is very, very difficult in healthcare. Although it would seem like, well, we're dealing with universal things here. We're dealing about the health of individuals. Health science is a global thing. Why is it so hard to take working systems from here and put them over there? And a lot of that has also to do with regulation. Again, it's understanding, the larger system. So that would be my answer to, the biggest challenges. Catherine would probably have some more practical examples in terms of actual challenges that we see, because she also deals a lot in our public sector. Catherine, I don't know if you...
Yeah, I think my biggest challenge to change is often, as I said earlier, is definitely people. And the argument that comes up time after time after time again is, well, it's different to the way we've done it before. But I also think often my experience has been the most resistance to change or not understanding something in a hospital environment or in a health facility environment is the lack of understanding of how that change impacts what happens before your particular role and impacts what happens after your role. And if you put that change into a wider context, if you say, if the change that we're making here in this particular instance impacts what happens further down the line, or what they're changing before what we're doing, if you put that into a much wider context and you instill a sense of understanding in that what you're changing is not only for you and your job, but actually has a much wider impact along the whole continuum of care, then you create far more of a willingness to engage with that change rather than just focusing specifically on that one individual thing.
I agree with you. So what you're saying, it's the way you look at it, or the scope of the entire. Okay. Could you perhaps describe the intensity with which hospitals or health systems have recently been approaching innovation today?
Yep. Well, shall I go? Do you want to go, Derry?
You go first.
So I think the circumstances are obviously very special at the moment, and that we're all feeling a huge intensity of change all over the world. And we are here in South Africa as well. And things have been changing in the public sector and the private sector at an extreme pace as people have to adapt and have to learn how to do things differently in a very short space of time. One of the biggest impacts that we've seen is the use of telemedicine and how acceptable that's become. So in South Africa, just a few short months ago, although I'm sure it feels like a lifetime ago to a lot of people, telemedicine wasn't acceptable as a form of consultation. And our insurers and medical schemes said that they weren't going to pay any of our doctors or anybody like that if you engaged in sort of virtual consultations, and that has changed almost overnight. So from having to have face-to-face consultations, there is now a plethora of different ways of having virtual consultations for almost every single specialty. So from psychology interactions through to some, tertiary type interactions as well. So the rise of telemedicines just in these short months in South Africa has been phenomenal in the private and the public sector, and in the change of attitude of the insurers towards it. So that's been fantastic because it's been able to provide access to medicines. It's been driven by the ability to provide services in a context where people obviously weren't allowed to leave home, or were too ill, or were prohibited from attending a doctor if they weren't allowed to leave their home, if they were in quarantine or in lockdown. So from that perspective, we've seen a massive rise in telemedicine and all the different forms thereof. Derry, do you want to add to that?
Yeah, it's a pandemic like COVID will always drive, this kind of necessity to completely overhaul a health system, and and even though it may seem like, well, we're only doing it temporarily because we're going to go back to this. I mean, eventually common sense takes over and you realize why. This was actually working great, and we were getting great outcomes. And it's one of the things now in terms of when you ask the question, what is the intensity? It's a weird word to use. I think the intensity. You kind of you get brings up kind of visual or mental images of rooms full of guys, trying to find new ideas or sweating away and crunching something, to come out with stuff. And that may or may not be true. It would differ from system to system and the priorities that each system has in place. A developed nation has a different set of priorities in terms of the areas that it wants to innovate in versus ours. For example, one thing though that we have seen that is, I think, global is getting to understand, and this sounds, in terms of where we're spending a lot of time or where the intensity is getting to understand how are we measuring outcomes of things in healthcare. And it speaks specifically to, we've moved away from, particularly in an insurance setting, which is, well, I used to pay that amount of dollars for that procedure, and now I only pay this. Great outcome. Right? We've kind of gone beyond that, and we're a lot more sophisticated, and we're now approaching the realm of what we call these value-based outcomes, which is actually measuring, is the state of health of the patient better, right? Or at least the same as when he or she entered our health system. It's been an incredibly tricky thing to manage. And we started to see it comes when with the onset of the Affordable Care Act brought it in and said, payment based on value-based outcomes, and everybody's scratching their head saying, well, how the hell do you measure that? How do you measure that in a consistent manner? How do we programatize or systemize the measurement of this thing? It is such an individual thing. And we've seen massive amounts of efforts now from academia, from private sector, from systems developers, from hospital groups, from insurers, everybody trying to get to the answer of, what is the best way to measure health outcomes, right? And then tie them to some sort of return, tie them to some sort of consequence. And it's a really, really difficult thing. So that would be outside of the COVID environment. So despite COVID and everything else with COVID, I mean, man, there's been some phenomenal progress because of COVID. And I hate to say because of COVID, it sounds, crass. But I mean, you look at facility development and how quickly we put things together to cater for this emergency and this requirement. And that required, massive amounts of manpower, massive amounts of thought. The requirement for engagement and change, I guess, was brought upon the populace. So you didn't have to spend too much time there. But, the speed in which we are turning around massive healthcare development, hospital development, is phenomenal. So, yeah, and I think, and we have now the vaccines that we're pushing for. I mean, there's probably some warning signs in there, and we'll see if we get anywhere. But the speed in which we're turning out these types of interventions because of something like COVID is, well, I guess it's the jury's out whether it would be good or bad, and we hope it's good. We know it can be done. It's now kind of a wait and see. I think we're still too much in the flow of it to understand whether this was a true innovation or we've moved massively forward because we can now get this done in X amount of time, or if we should have taken a little bit more time, and I guess time will tell. So yeah, I mean, that's if anything around the intensity of where people are focusing. COVID is one thing, but post that, we see a lot around these value-based, these health measurement outcomes, and I think there's still a lot of work to do.
Derry, thank you very much for that. We have a couple of questions in the chat, actually. From
Cool.
Zaid is one of them, and he asks, are there any particular frameworks around driving change that you recommend or have experience to work with? For example, Cotter's change model.
Yes. it's probably a combination of a lot of theory. There's some partners that we work with that have taken a different view. So it came out of the wellness framework, the idea behind the relationship between an employer and their insurer, and what it is they can do, and the insured that sit within the population. What is it that we need to do to get them to be healthier? Now that's it seems like a flippant question, but that was kind of the basis to say that's it. So we've spent a lot of time understanding the current interventions that exist within there, and we noticed a theme across all of them. And the theme was this: that in order to motivate somebody to go from a position of being at risk from their health point of view, so whether they are obese or inactive or eat badly or whatever the case is, how do you get that person to stop being that? How do you get them to change their behavior, to being active, to being less at risk, and to looking after their health? And the almost universal response to that has been that we will motivate that person through financial incentive. So we will offer them access to things that benefit both parties, and most of these are health related. So we will give you a gym membership, either for free or discounted. If you do a certain amount of exercise within a week, you will get access to certain discounts, or we'll actually give you kits. We'll give you devices and watches and all that type of jazz. So there's very much this kind of commercial incentive that we basically pay you to do this, and if you do this, we'll pay you. So it's that kind of continuum. And by and large, and there's a lot of money spent on this kind of platform. South Africa was, we were almost the pioneers in that space. So we have the company here that was based here, which is now the world's largest wellness company. But we cannot find any credible evidence that it works, and particularly over an extended period. Because what we see is kind of the initial excitement of these things, where people are saying, yeah, oh, great, I get access to all this, I'm going to go to the gym, etc. But what we don't see is the long-term effect of that. In fact, we just see drop-offs. Because what was exciting to me now stops becoming exciting very quickly, particularly when it's a hassle. When it's way easier for me to just carry on doing what I do. So as a motivator, we found that money or financial incentives are poor. So if that is, we take that as fact and we build from there. So then what does it take? What do we need to understand? What are the motivators for people to change? So changing your behavior is habitual. And so it's something now that I need to do often, and is different from what I'm doing now. So how do we create these new habits? And what keeps people excited about creating these habits? And so it's very much a position of understanding intrinsic versus extrinsic motivators. Things that I would like to do anyway for myself, that makes me feel good, that kicks off that dopamine in my brain and says, yeah, this is great. I'm enjoying this. I'm motivated by doing this. There are a lot of factors that are built into getting that. There isn't one answer. So it's not financial incentives, it's this. I wish it was, but it isn't. So it is a whole slew of interventions, both personally, at home, in the workspace, within your engagements, your social gatherings, your circle of friends. It's understanding all of that and what that means and the effect that it has on you. So, I don't want to go on and do the whole program, but yeah, we spent a lot of time understanding change and understanding that we've got it wrong. The whole industry has large, I would say the whole industry, a large chunk of the industry has got it wrong. We spend a lot of our time trying to engage with those who are about to undertake this journey to not make the same mistakes, to understand that if you are truly after a improved health outcome in your populace, you need to understand that paying them to do something is not good enough. In the same breath, it's also not good enough to tell them why what they're doing is bad. I think, when we're doing the brief for this, we think about, communication. So it must be about communication. Tell people, how how bad something is. That works. No, it doesn't. We know it doesn't. There's all the evidence in the world to saying that information by itself or education doesn't change how I behave. You know, people know smoking is bad for them, but they'll still do it. It's not the thing that gets them to stop. So what is it? And yeah, that's where we go. So that's our position on change, which, by the way, is the same thing then about understanding how you drive innovation. So understanding then if this gets me excited in a certain way, enough to engage with it in a way that it is meaningful, then that thing will be innovative. It will promote change.
Derry, thank you very much for that. I've recently read the book called Power of Habit, and it feels like you've mentioned many of the things that I've read in there, so yeah. It brings good memories back. And I absolutely agree with you in terms of those things, especially when, for example, New Year comes and all those gym subscriptions start coming in, and you do it for a week or two, and then, life kicks in.
Yes.
We have maybe 1 or 2 more minutes. Do you have any closing remarks before we end off? I mean, the conversation was so fun.
It was fun.
I just have some thoughts around what we've learned in South Africa, and I think it's got to do with change, huge time through these past couple of months. And Derry, please feel free to jump in. And it's affected everything we've spoken about now, and that's how we've learned to be more flexible in everything that we do in terms of healthcare. So over the last couple of months, Derry and I have been privileged enough to be engaged with the healthcare system at all different levels. So from helping with human resources for health to the access to medicines and the supply chain, as well as the hospital infrastructure in setting up all these different field hospitals. And what I've seen is a tremendous response by people to having to do things a new way and introducing flexibility into a massive health system that has traditionally moved at snail's pace. So to try and get something changed has always taken months, if not years, of trying to change regulations and legislations and the way people do things. And now all of a sudden we were setting up hospitals in the blink of an eye. We were able to change being able to prescribe chronic medicines for a year, whereas before it was only between 3 months and in special cases 6 months. We were able to introduce a rapid review system of medicine. So we've been moving very, very slowly towards the implementation of health technology assessment. And within a few weeks, we had the governance structures set up to enable rapid reviews of medicines that would benefit society during COVID-19. We were looking at setting up temporary field hospitals, but what we've learned from that is, can we put that into future hospitals? So instead of building huge brick and mortar hospitals, can we not look at a solution where you can have hospitals that you can add on to when you need the extra space, but then also take away from when there's less demand for hospitals? So what we've learned is that people can be flexible and that they can change quickly and that you can push through some of these ideas in times like this. And hopefully we can take what we've learned from these last couple of months as we move into the future. Mr. Heron, Derry, is there anything you want to add?
Yeah, I mean, I think that's kind of spot on. And I've been going through the comments and the questions on the hop-in side. I mean, some great comments that I've seen here, and some great questions. Hans has a great saying here: "Tech goes fast, and culture changes slowly." That's brilliant. And I think a lot of what we talk about in change and in areas of change does talk about a cultural shift more so than levers. So whether it's in a hospital or whatever, because bringing the tool is the easy part. Getting people to engage with that thing in a way that is seamless, painless, and gets you the results that you want, that requires the buy-in of multiple levels and of massive amounts of people. So we are talking about a cultural shift, and that is a very slow-moving thing. And that's where frustration comes from. These guys are saying, well, God, technology is there. I mean, if you look at, technology is supposed to improve exponentially. We have Moore's law and explain these things, and as a society and as a population, we've created, things to be able to go through this. But we forget what these things are for and who uses them. It's still us. It's the bag of blood and bones. And unfortunately, we're stubborn beings. We will resist change as much as possible. All of us will. Some of us say, oh, we thrive on change, and. Yeah, you thrive on change, I think, mostly when it suits you. As a population, we're a hard thing to move and a hard thing to do. Now, we understand the necessity often of saying, guys, we need to do the things differently to get a better outcome. Again, COVID is a great example of that. Mass adoption of, social distancing, wear a mask. Great. I mean, these are things by and large that people understand and know and get the value from. It's not hard to explain to because it's personal for them. And so we need to spend more time, I think, understanding and managing expectations of that. Although technology can move at the speed of light, the change in which it hopes to bring about may take a bit longer. Right? Understanding the human element is as critical as any bit of code that sits behind that thing, even automated codes, even the likes of AI and the rest of them. We were chatting earlier to some guys when Tom was on, about AI is largely a result of data, and you need good data. Otherwise, it's garbage in, garbage out. That work and that understanding is the same as saying, driving change. What's my equivalent of data? Making sure that I don't get garbage in or garbage out, or nothing in and nothing out, despite a great piece of tech or a new idea. And so there are ways to understand that. There are ways to manage the expectation of when should I start measuring or when should I start seeing some sort of change. It's not always immediate. Where are we falling short? Because it's great to do things retrospectively. A lot of companies be doing it, despite millions of dollars spent on whatever we've done in the past, we're not seeming to get what we thought we would. I mean, ask anybody that has put in an electronic health record or has tried to do a device-driven program for self-measurement and saying, well, why are people still not eating well? Why are they still not exercising? Why did they start well and now not anymore? It would pay to start asking kind of those kind of questions and what drives it. But yeah.
Derry, Catherine, thank you so much for joining me today at the third edition of the Future of Health Virtual Summit. I'd also like to mention that you are our speakers at the Future of Health conference.
We really hope we can be there. We're looking forward to it.
Yeah,
we are looking forward as well. Thank you so much for joining me today, and hope to see you in just under 2 months.
Yep.
Great. Thank you.
Thanks.